let's dive into their fascinating history and development. The story begins in the 1950s with Sir James Black. He aimed to alleviate angina, severe chest pain due to reduced blood flow to the heart. His research led to propranolol, the first beta blocker, in the early 1960s. Propranolol revolutionized cardiovascular disease treatment. This innovation earned Sir James Black the Nobel Prize in 1988. Beta blockers also treat anxiety, migraines, and tremors. Modern beta blockers like metoprolol and atenolol offer targeted action with fewer side effects. Students, today I'm diving into everything you need to know about beta blockers. Beta blockers reduce blood pressure by blocking adrenaline. They target beta-1 and beta-2 receptors, slowing the heart and improving blood flow. Common types include propranolol, metoprolol, and atenolol, used for hypertension, angina, heart failure, and anxiety. Side effects include fatigue, cold hands, weight gain, and dizziness. Never stop abruptly, always taper off under medical supervision. I hope this breakdown helps you understand beta blockers better. In this chapter, we'll explore how beta blockers work in the body. Beta blockers target beta-adrenergic receptors in the body. There are three main types of beta receptors: beta-1, beta-2, and beta-3. Catecholamines like adrenaline bind to these receptors, triggering physiological responses. Beta blockers block this binding, reducing heart rate and contractility. This helps lower blood pressure and alleviate angina symptoms. Some beta blockers are selective for beta-1 receptors, while others are non-selective. In this chapter, we'll delve into the common uses of beta blockers. Understanding their diverse applications is essential for grasping their therapeutic versatility. Beta blockers, as we've discussed, are primarily used in cardiovascular conditions. One of the most common indications is hypertension. By reducing heart rate and cardiac output, beta blockers effectively lower blood pressure, making them a staple in hypertension management. Another significant use is in the treatment of angina pectoris. Angina is chest pain caused by reduced blood flow to the heart. Beta blockers help by decreasing the heart's oxygen demand, thus alleviating the pain and discomfort associated with angina. Beta blockers are also crucial in managing heart failure. In heart failure, the heart struggles to pump blood efficiently. By reducing the workload on the heart, beta blockers improve symptoms and enhance the quality of life for patients with heart failure. Atrial fibrillation and other arrhythmias are another key area where beta blockers shine. These medications help control heart rate and reduce the risk of complications associated with irregular heart rhythms. Beyond cardiovascular uses, beta blockers have applications in other conditions. For instance, they are used in the management of anxiety, particularly performance anxiety. By mitigating the physical symptoms of anxiety, such as palpitations and tremors, beta blockers provide relief to individuals facing stressful situations. Beta blockers are also prescribed for migraine prophylaxis. While the exact mechanism is not fully understood, these medications reduce the frequency and severity of migraine attacks for many patients. In summary, beta blockers are versatile medications with a wide range of applications. From managing hypertension and angina to treating heart failure, arrhythmias, anxiety, and migraines, their therapeutic benefits are vast. Understanding these common uses enhances our ability to prescribe and monitor beta blockers effectively. That's it for this chapter. Stay tuned for the next video, where we'll explore the practical aspects of prescribing and monitoring these essential medications. In this chapter, we'll explore the potential side effects of beta blockers. common side effects include fatigue and cold extremities. Beta blockers can reduce heart rate, causing dizziness or bradycardia. They may also affect respiratory function, especially in asthma or COPD patients. Gastrointestinal issues like nausea and diarrhea can occur. Mood changes, including depression and anxiety, are possible but less common. Understanding these side effects helps in managing and optimizing treatment. Today, we'll explore alternatives to beta blockers. Beta blockers aren't suitable for everyone due to side effects. Alternatives include calcium channel blockers, ACE inhibitors, and diuretics. Calcium channel blockers relax blood vessels, reducing heart workload. ACE inhibitors prevent hormone formation that narrows blood vessels. Diuretics help eliminate excess salt and water. Lifestyle changes like exercise and diet can also help. These options ensures personalized care. In this chapter, we'll discuss the use of beta blockers in special populations. Beta blockers can be particularly effective for elderly patients, but they must be used with caution due to increased sensitivity and the presence of other health conditions. Pregnant women need to be careful when using beta blockers, as they can affect the developing fetus. Always consult a healthcare provider for tailored advice. For children, beta blockers are generally not the first line of treatment and are used only when absolutely necessary, under strict medical supervision. Patients with kidney issues need special attention, as beta blockers can affect kidney function. Diabetic patients should also be cautious, as beta blockers can mask the symptoms of low blood sugar, making diabetes management more challenging. It's crucial for healthcare providers to consider these special populations when prescribing beta blockers to ensure safety and efficacy. Remember, personalized care is key to effective treatment. In this chapter, we'll explore the relationship between beta blockers and exercise. Beta blockers can influence how the body responds to physical activity. They work by slowing down the heart rate, which can affect exercise performance. For athletes, this can mean a reduced maximum heart rate and altered endurance levels. It's important to know that while beta blockers can help manage conditions like hypertension and arrhythmias, they may also make it harder to reach peak performance during high-intensity activities. However, for those with cardiovascular issues, beta blockers can make exercise safer by preventing abnormal heart rhythms and reducing the risk of heart attacks. Always talk to your healthcare provider about how beta blockers may affect your exercise routine. They can help tailor an exercise plan that fits your health needs and medication regimen. Remember, staying active is crucial for overall health, but it's essential to do so safely while on beta blockers. Keep learning and see you soon. In this chapter, we'll explore the intriguing relationship between beta blockers and mental health. Beta blockers are not only used for physical conditions, but can also play a role in managing mental health issues. They are often prescribed to help reduce symptoms of anxiety, particularly in situations that provoke performance anxiety or social anxiety. By blocking the effects of adrenaline, beta blockers can help reduce physical symptoms of anxiety, such as rapid heartbeat, sweating, and tremors. However, it's important to note that while beta blockers can help manage the physical symptoms of anxiety, they do not address the underlying psychological aspects. Therefore, they are typically used in conjunction with other treatments, such as cognitive behavioral therapy or other medications. For those with mental health conditions, it's crucial to have a comprehensive treatment plan tailored to individual needs. Always consult with a healthcare provider before starting or adjusting any medication regimen for mental health. Understanding the multifaceted uses of beta blockers can help you provide better care and advice to your future patients. Keep learning. As we conclude our deep dive into beta blockers, let's take a moment to look toward the future. Video researchers in a lab. The landscape of beta blocker research and development is ever evolving. Image innovative medicine. New formulations and delivery methods are being explored to enhance efficacy and reduce side effects. Video cancer cells under a microscope. Researchers are also investigating the potential of beta blockers in treating a wider range of conditions, including certain types of cancer and neurodegenerative diseases. Video DNA strand animation. Moreover, advancements in personalized medicine are paving the way for more tailored beta blocker therapies, ensuring that patients receive the most effective treatment based on their genetic makeup. Image clinical trial participants. With ongoing clinical trials and cutting-edge research, the future holds promising possibilities for beta blocker applications. Video pharmacist consulting a patient. Being informed about these advancements will empower you to provide the best care and advice to your patients. Thank you for joining us on this educational journey through the world of beta blockers. Keep pushing the boundaries of knowledge and continue to make a positive impact in the field of pharmacy. Video closing shot of a university campus. See you in our next series.